Hello and welcome. How far would you go to get the medical treatment you need? Millions of Americans are willing to cross oceans for treatments, but they could be gambling with their money and their health when it comes to certain procedures. Stem cell treatments in particular are providing hope for those who can't get them in their home countries. At times the procedures are legitimate, but at other times what's on offer is questionable. Now, this is just one aspect of a massive trend known as medical tourism, taking over the healthcare industry. According to the international consulting firm Deloitte, an estimated 750,000 Americans traveled abroad for medical care in 2007. Aggressive projections put this number somewhere around 6 million by 2010. And this exodus from the US is estimated to be already worth $21 billion per year to developing countries. Now, healthcare may be high on the agenda of millions of Americans, but it's also important in countries where universal medical cover is cracking under poor funding, longer wait times for procedures, and increasing costs. For many, paying for a plane ticket and treatment overseas in luxurious facilities with high-quality care is well worth considering. Well, today's show looks at the effects of globalization on healthcare, both in the US and in other countries, and joining with your questions and comments. Now, I have a great panel of guests to look into the pros and cons of this rapidly growing industry. Here in the studio with me is Joseph Woodman, the president of the Healthy Travel Media Company, who spent more than 3 years touring 100 medical facilities in 14 countries, researching contemporary medical tourism. Joseph also serves on several advisory boards on global healthcare and is the author of Patients Beyond Borders, a guide to international medical travel. From Rutgers University is Dr. Wise Young, the leading professor of neuroscience there and world-renowned researcher in spinal cord injury. And on the phone from Mumbai in India, we have Vishal Bali, CEO of the Walk Hard Hospitals, which are particularly popular with medical travelers who choose to go to India. Welcome all of you to the show.
Thank you.
Good. Joseph Woodman, if I can begin with you and ask about the difference between medical tourism and medical travel.
Well, it's a great question, and it has to do with how contemporary medical travel grew up. The term medical tourism actually grew out of India, the India Tourism Board, the same folks that brought you Incredible India.
All right.
We're looking for a way to characterize the phenomenon of folks from the UK mostly who are beginning to travel in droves because of the breakdown of universal health care in the UK and long wait times for expensive procedures. And so the term, I wish I had the count, the Google count when I first saw medical tourism hit 4 years ago, something like 897 returns. Now there are millions and millions. We prefer the term medical travel. Medical tourism tends to refer to, it started in the early days, have a tummy tuck and take a vacation. Right. And we truly don't believe it works like that. And most patients that we've interviewed don't feel that after even a minor surgery, an extraction, let alone an orthopedic surgery, that they're going to want to take a vacation. They want to get back to their homes and their families and their inboxes.
Why is it such a rapidly growing business now?
Oh, it depends on where you are. In the United States, the U.S., as most people know, it's on the tongues of all the politicians. It's a big presidential platform. We've priced ourselves out of the healthcare market, and people are seeking lower costs. For folks in other countries, among the 1.5 million to 2 million people that travel in other countries from one country to another for healthcare outside the United States, it's quality of care. The healthcare just simply doesn't exist in their country. Middle classes are rising, economies are rising, and they're traveling to places like Thailand, India, Malaysia, and other destinations for healthcare.
Well, Dr. Wise Young, it's an honor to have you on our show, sir. And I've got to ask you. You know, in many cases, people looking for treatments in areas that might not be available in their home countries. These include things like stem cell treatments and so on. I wonder, as a leading researcher in neuroscience, can you assess for us what sort of risk they're undertaking when going for these kind of treatments?
I think people have to be very careful. Stem cell therapies are not well established anywhere in the world, and there are many fraudulent claims, hypes, these many scams. People really have to be very careful. The regulatory environment in some of the countries where these stem cell therapies are being offered is not as rigorous as, for example, in the United States. And so people need to do their research very carefully, and if something sounds too good to be true, it is too good to be true, and people should not do it.
But of course,
on the other hand,
I was going to say, Doctor, when people get desperate, obviously they have people who are severely in need of help. obviously their prime concern is just to try to get them some kind of help. And I wonder, excuse me, when they're looking at that kind of situation, when they can't get that kind of treatment at home, what sort of options do they have overseas?
Well, I mean, I think the issue is really whether they should get any therapy at all versus, getting a therapy that doesn't work. And so a lot of these people charge what I call the Volkswagen price, for medical treatments. It's around $20,000–$25,000. This is what people can afford. They would go there and they would get a umbilical cord blood stem cell therapy or some bone marrow stem cell therapy, or in some cases the claims have been embryonic stem cell therapies. You never know what you're getting, and there's no follow-up on the patients to find out whether or not the treatments work. And so people need to be very careful. They need to do their research very carefully. They need to actually find out what they're getting. And I think they should be more cautious than they would be, for example, in the United States.
Well, Vishal Bali, I want to welcome you in from Mumbai, and thanks for joining us at what is a very late hour for you. India, of course, has some of the best doctors in the world, but I wonder, when it comes to actually getting people to come there for treatment, what's the attraction? Why should people go for treatment to India?
First of all, pleasure, Riz, to join you on the show from here in India.
Thank you.
I think basically what India offers is very effective capabilities, as you very rightly said, that India has a very large pool of clinical talent. Doctors from India have made a big name for themselves all around the world with their competencies. Secondly, the services of the new generation hospitals in India, which is also the face of New India. These new generation hospitals are very well equipped. They are manned by some of the best clinicians, and they are very, very hospitable in terms of their services. And I think the last but not the least, the large domestic consumption of healthcare makes the cost of healthcare very affordable in India. So what people get truly in India right now is good medicine which meets very affordable costs. And that is exactly the reason why we find that patients from all over the world, and particularly the developed world, are coming here to India.
Okay.
So, because patients are used to getting treated by Indian clinicians back home, so therefore they are saying that why can't I just pack my bags and go to India and get treated by an Indian clinician in India?
Okay. We have a caller on the line from Nigeria. Mohammed's on the phone. Mohammed, good to have you with us. What would you like to ask?
Okay, my question is this about medical tourism.
Yes,
So we didn't see that kind of thing happening in Africa, because recently I have a problem where one of my grandmother fell sick. She was trying to get a visa to United States of America. Hello?
Yeah, go on, keep going.
She was trying to get a visa to United States of America, but because of the hinges, that is there, so she cannot be able to secure the visa. At the same time, she happens to lost her life.
Interesting point you raised there, Mohammed, and I want to put that to you, please, Joseph Woodman. I guess many countries are having to adapt the way they let people in and out, certainly from a visa perspective. Here, our caller was saying that, Africa may have a particular problem, that one person they knew died because they couldn't get a visa that would give them treatment elsewhere.
It's a difficult problem. I know, for example, I was just in Taiwan, and the air routes just opened up from Shanghai and Beijing into Taipei, which excited lots and lots of folks, because as most people know, there's just not the quality of medical care in China and in the rural areas as there is in Taiwan. The problem is you can't get a visa out of China. So there are each country has its own challenges and its own difficulties, and it takes a lot of advanced planning to cross borders for medical care.
Dr. Young, of course, America is known to have such incredible facilities for so many across so many areas, and I wonder, does it worry you that so many Americans now looking to go overseas? The estimated projections are huge.
Well, as you know, for many years, decades, American medicine was really the center for everybody to go to. And everybody went to Mayo Clinic, Case Western, etc. And the famous medical schools in the United States were the medical travel destinations for the world. And now it's heading back in the other direction. Particularly in the area of stem cells, where I think we've had very slow development of stem cell technologies and therapies in the United States. Many people are now going over to China, for example, to get their therapies. I run a 25 clinical trial centers in China testing stem cell therapies, and one of the things that I'm inundated with are all these people with spinal cord injury calling me saying, how can I go to China to participate in the clinical trials? And it's an interesting reversal of roles. I think that this does tell you that the medical care in China and in Taiwan, by the way, they're both rising quite rapidly, and this is of course because there's a very large wealthy class in China now demanding the top of the care from the hospitals. They estimate 100 million millionaires, for example, in China.
Well, gentlemen, I'm going to ask you to stand by because we have just a short break coming up. We'll see you with more on this discussion when we return. Don't go away.